Hello everyone, I'm at the Western Development Museum in Moose Jaw, where they have a display concerning the history of Medicare. Saskatchewan is, after all, the birthplace. Birthplace of Medicare. Deep roots. Ask almost any Canadian about what it means to be Canadian, about our core values and way of life. And universal free Medicare is sure to be near the top of the list. Since Saskatchewan, some would say, a rather unlikely place. The Medicare was born. When the system came into effect on July 1st, 1962, it did not come out of nowhere. It was the culmination of a dream of decades of innovation by people of vision. Why did Saskatchewan lead the way? A spirit of cooperation forged by hardship on the homestead inspired leadership at local and provincial levels, and the right people in the right place at the right time combined to make it possible. Before the Europeans, healing herbs. Long before contact with Europeans, First Nations people had their own way of treating sickness and knew that certain herbs and other medical plant materials like muskeg tea and rat root had medicinal properties, that these medicines could elevate conditions such as headaches or stomach problems. Knowledge of traditional medicines gathered over countless generations passed from generation to generation by traditional healers who acknowledged the gift of the creators. New diseases. Contact with Europeans. New diseases brought by European adventurers and traders, and smallpox wiped out entire communities. Scarlet fever and whooping cough, diphtheria, and tuberculosis brought suffering and death to people who had no immunity to these diseases. First Nations chiefs recognized that traditional remedies were not effective when treating new disease. Treaty 6, negotiated at Fort Carlton in 1876, contained provisions for a medicine chest to be used for treating First Nations people. Chest may have been similar to this one. The chest may have been similar to this one, brought by an English shaman to the West in 1881. Born tuberculosis. Tuberculosis was the killer between 1877 and 1927. Took more lives than any other disease in Canada. The infection usually attacked the lungs, but could also affect other body systems. Patients suffered from persistent cough, fever, and night sweats, also called consumption tuberculosis. TB was spread by coughing, spitting, poor sanitation, drinking milk from infected cattle. Dr. Maurice Seymour was the right person at the right time in charge of public health. At his urging, the Saskatchewan Anti-Tuberculosis League was formed in 1911. Convinced the league to build a sanatorium near Fort Capella in 1917, appointed Dr. Robert Ferguson as its head. Dr. Ferguson was also the right person at the right time. In 1921, he conducted his first TB surveys of school children. Surveys, a first in Canada, showed an alarming incidence of tuberculosis. Ferguson called for more sanatorium beds and for treatment regardless of ability to pay. Home away from home. Tuberculosis could strike anyone for many of its fixes. Sanatoria at Fort Sands, Saskatoon, or Prince Albert were home for months, sometimes even years. Bed rest, fresh air, sunshine, and insulation, and isolation from non-infected people were standard treatment. Sometimes surgery to intentionally collapse a lung, enabling it to rest to recover, was prescribed. With as many as 360 residents, Fort Sand was bigger than many villages. It had its own powerhouse, garden, poultry, and pig farm, library, a monthly magazine, drama club, radio station, woodworking shops, and even a jazz band helped patients pass time. Leading the way, Saskatchewan achievements. Saskatchewan boasts many firsts in the war on tuberculosis. France was first in North America to provide free TB treatment. Public support was second to none in North America. Pioneering TB testing surveys were conducted in Melville, Moose Jaw, and Weyburn. Saskatchewan was first to organize province-wide mobile chest x-ray surveys aimed at early diagnosis. Robert Cornell, a radiographer, came up with an inexpensive way to photograph the x-rays. Dr. Ferguson conducted groundbreaking studies on the prevalence of TB among First Nations people who were hit particularly hard. Other provinces and even countries viewed Saskatchewan as a model. Polio. Most of us know little about polio, but years ago, mere mention of the word was terrifying. Saskatchewan was hit by 4 major outbreaks of the disease between 1920 and 1950. Children and young people were most at risk. Polio usually caused paralysis of the back, arms, and legs. Another kind of polio paralyzed the throat and chest muscles. Many victims were disfigured or died from the awful disease. A special clinic was set up at St. Paul's Hospital in Saskatoon to deal with polio outbreak in the early 1940s. Hospital fees for patients were paid by the provincial government. There was no cure for polio, so treatment focused on prevention of deformities. Hot packs were put on muscles and joints, and patients were given massages, physiotherapy. Some were put on respiratories called iron-ons to help them breathe. A more widespread outbreak in 1947 affected some 277 patients, so clinics were set up in Regina and Moose Jaw. And here is the iron lung. Living in a machine. The wheezing and hissing machines altered air pressure around the body, forcing the patient to breathe. People sometimes spent weeks, months, or even years in these machines. Fall of 1952, St. Paul's Hospital had 9 iron-ons operating around the clock. Dozens more operated in major hospitals. Nurses were run off their feet attending to patients. By 1954, the epidemic had subsided, but the medical community was kept busy providing rehabilitation services to polio patients. When a vaccine against polio became widely available in the late 1950s, children across the province were vaccinated at local schools. Once again, here is the iron lung. Saskatchewan's first response to polio was sophisticated and generous for the times. In 1929, a serum was given free to polio patients. Polio unit was set up in 1937 at the Grace Gun Hospital in Regina. The province provided 3 weeks of free hospital service. During the 1948 epidemic, the province paid hospital charges for patients. The Saskatchewan Council for Crippled Children and Adults, now the Saskatchewan Ability Council, was set up in 1949 to help deal with the effects of polio. The province expanded rehabilitation facilities after the 52-53 epidemic. In the 1950s, Saskatchewan carried out a free massive vaccination program. Canada's first community-wide field trial of the oral Sabin vaccine took place in Prince Albert. The Prince Albert trial was followed in 1962-63 by the most ambitious immunization program in Canada. Cancer, a growing concern. Although tuberculosis was the #1 killer in Saskatchewan in the early 20th century, the number of deaths from cancer was creeping up. By 1924, the death rate virtually equaled that from TB. Between 1924 and 1941, the rate of cancer deaths more than doubled in Saskatchewan. Something had to be done. In 1929, the Saskatchewan Medical Association created a special committee to discuss cancer and ways to treat it. The provincial government gave the new Cancer Commission the power to create cancer clinics, buy radium for treatment, and obtain the necessary equipment. This was Canada's first province-wide strategy for the control of treatment of cancer. Commission members studied what was being done by experiments around the world. Dr. Harold led the Saskatchewan team that built the world's first properly calibrated cobalt-60 bomb for treating deep cancerous tumors. With graduate studies, Lloyd Bates and John McKay, owner of Acme Machine Shop in Saskatoon, Johns oversaw the design and installation of a specially built room at the University Hospital. Early in November 1951, the first patient, a woman in her 40s, was treated with a carefully calibrated dose of cobalt-60 radiation. She lived to age 90. Cobalt-60 treatment gained widespread acceptance. Dr. Johnson physicist Celia Fedorlick, along with other members of the team, literally wrote the book on its use and produced accurate dosage charts which were used worldwide. Saskatoon's original Cobalt unit treated more than 6,700 patients before it was replaced 21 years later. Here we have the air ambulance. A 20-mile-an-hour wind, which had blocked highways with its possible snowdrift, pushed the Norseman about on the runway on the initial takeoff. But once pilot D.K. Malcolm got away, there was no further trouble. He landed in a stubble field 3 miles away from Liberty. The fledgling air ambulance responded to its first call on February 3, 1946. With ex-Royal Canadian Air Force pilot Keith Malcolm at the controls. Don Watson, aircraft engineer, and former Army nurse Emil Gleddow rounded out the crew. The diabetic patient was airlifted to a Regina hospital. And here is that air ambulance. Air ambulance, there we have it, folks. Tommy Douglas.
I think that we've come to the place where medical care, like education, ought to be available to every citizen, irrespective of their financial state.
1915, North America's first municipal doctor.
Once again, Saskatchewan led the way. After 1 year under Medicare, Saskatchewan had more doctors making more money than ever before. In spite of the compromises, the Saskatchewan Medicare plan became a major success, envied by other Canadians.
1916, Union Hospitals the first. Municipal hospital care plans. 1929, pre-diagnosis and treatment of tuberculosis. And there you have it, folks. The birth of Medicare. Thank you, Tommy Douglas.